Ladies and gentlemen, this is Lions Den with another news and commentary. I want to bring up this serious update that I'm about to read to you. This is very serious, y'all. Very serious. It's this new virus called the Lambda Variant. This Lambda variant is just as deadly as the Delta variant. Now, this article comes from NPR. It says the Lambda variant, what you should know and why experts say not to panic. And I'm gonna tell you why you should panic on this. So according to this article, it says while the Delta variant of the coronavirus has quickly become the dominant strain in the United States, it's not the only variant circulating in the population. The Lambda variant, first identified in Peru, is also making headlines as it started to be identified in several states. Houston Methodist Hospital reported its first case of the variant this week. Scientists of the Medical University of South Carolina recently announced they had found the variant in a virus sample taken in April. Okay, according to a database for scientists tracking coronavirus variants, fewer than 700 cases of the Lambda variant has been subsequent in the United States so far out of more than 34 million coronavirus cases reported to date. But the U.S. has subsequent only a tiny fraction of its cases, so that numbers do not reflect the actual number of Lambda cases in the country. I'm gonna stop you right there. Ladies and gentlemen, it's bad enough we're dealing with the Delta variant. Now we have another variant called the Lambda variant. It's just as bad as the Delta variant. Now I know a lot of y'all, a lot of people, a lot of experts, medical experts will tell y'all, oh, we're not gonna worry. Don't worry, that's not a concern. But in my opinion, you should be concerned. And we basically have to understand that our government mistake was to if you're vaccinated, fully vaccinated, that you should not wear a mask. First of all, they shouldn't even did that, because we never know what kind of variant it is. Now we do. And this is kind of concern because we already dealing with the Delta variant, but now we have to dealing with the Lambda variant too. It says according to a database for scientists tracking coronavirus variants, fewer than 700 cases of the Lambda variant has been subsequent in the U.S. so far of more than 34 million coronavirus cases reported to date. But the U.S. has subsequent only tiny fraction of its cases, so the numbers do not reflect the actual number of Lambda cases in the country. Fewer than 1% of U.S. cases in the last 4 weeks has been identified as a Lambda variant, according to GSID, a repository for known data. So, do we need to add Lambda to our list of big worries in the U.S.? Not yet, according to public health officials and experts. I'm gonna stop you right there again. My question is why? Why do the health officials said not to worry about this? We already dealing with the Delta variant. Now the Lambda variant's coming out from Peru, and we don't know how many. They've been knowing this since August of 2020, August of last year. They knew about the Lambda variant. And now they're starting to talk about it. They said that the Delta variant, which is more than 2 times as transmissible as the original strain of the coronavirus, now accounts of 83% of the new coronavirus cases in the U.S. Delta continues to be the central concern for public health officials. What we know about the Lambda variant. The Lambda variant was first identified in Peru in August 2020, according to the WHO. Cases with the variant has now been identified in 28 countries, according to the GSAD. Though many of those I have identified only a handful of Lambda cases. Dr. Stuart Ray is a professor of medicine at the Johns Hopkins Hospital, where he specializes in infectious diseases. Ray opened one of the first COVID-19 wards at Johns Hopkins in March of 2020. He had also overseen Johns Hopkins COVID-19 screening efforts. He tells NPR that Lambda is sort of a cousin of the Alpha variant, one of the earliest identified variants of concern. Lambda spread until it became a dominant sequence in people with COVID-19 in Peru. The WHO noted last month an elevated presence of Lambda in other South American countries, including Argentina, Chile, and Ecuador. And now we know it's present in the United States. The Lambda variant carries a number of mutations with suspected implications, such as potential increasingly transmissibility, or possible increased resistance to neutralizing antibiotics, the WHO said. But it's said the full extent of those mutation impact isn't yet well understood and will need further study. While there hasn't been a clear head-to-head data, the evidence so far does not suggest the Lambda variant has any great advantage of the Delta variant, Ray said. Delta is clearly the dominating right now, and so I think our focus can remain on Delta as a hallmark on a highly infectious variant, and there's some evidence that it might cause greater severity per infection, although that's still a development story, he said. I'm gonna stop right there again. See, we really didn't know about the Delta variant before, and now we didn't even know about the Lambda variant. And why now they don't want to talk about this? Why they want to keep it quiet? That's the question. It seems to me they don't want the public to know that there's a lot of variants out there of COVID-19, and they don't want basically a panic in the country. But already they didn't even talk about the Delta nor the Lambda until now. Let's finish this article. It says there isn't yet fully data on vaccine effectiveness against the Lambda variant. But so far, studies have found that the vaccine available in the U.S. provide protection against major strain of the virus, including the high transmissible Delta variant. And again, we don't know that for sure. And I'm gonna say it again, like the Delta variant, we don't even know if basically they say they protect us from Delta variant, but how do we know that? How do we know? They said we know that vaccinations almost uniformly protecting people, Ray said. The vast majority of hospitalizations and deaths from COVID-19 in the U.S. now are among unvaccinated people. Studies have found that the vaccines are less effective at generating neutralization antibodies against the variants of concern than against the original strain of the virus. But T cells also play a significant role in the body's immune response. And T cell response isn't measured in neutralizing antibody clinical tests, meaning that the vaccines could be more effective than the variants than is suggested by tests of antibody response alone. It said that the WHO now assigned Greek letters to strains of the coronavirus that are classified as variant of concern or variants of interest. I'm gonna stop you right there again. So they changing the Greek letters. Now remember, at first they said it was the South African variant, it was the Brazilian variant, and the UK variant. Now they change it for all the Greek letters, like the fraternity or the sorority Greek letters of the variants. So y'all, ladies and gentlemen, and I know what they're trying to do. They're trying to please everybody, and they think it was normal. But realistically, y'all, it's not normal. We have like almost hundreds of thousands of people right now have either contacted coronavirus or close to getting COVID. This is really serious. Really serious. Let's continue with the article. It said a variant of concern is one that has characteristics such as being significantly more transmissible or more virulent. The alphabetical order of the variant Greek letter names indicates that the order in which they were identified as potential important. They are not in any particular alphabetical order of severity. The alpha, beta, gamma, and delta variants are all considered variants of concern by the WHO. The WHO classified Lambda last month as a global variant of interest, a step below variant of concern. That means it exhibits genetic changes suspected of affecting and its transmissibility and disease severity have been identified as causing significant community transmission of multiple COVID-19 clusters. The Center of Disease Control and Prevention keeps its own list of variants and concerns and interests within the United States. Notably, the Lambda is not on the CDC's list as being a variant of interest and concern or high consequence. And I'm going to stop right there again. See, the CDC basically should have all the variants be concerned, not just one or the other. And that's what's so sad about it. They always pick the Delta, but not the entire list of the variants. They should have added that to the list. So it continues to say that Ray said tracking variant is important. Tracking variant is important so that we don't get blindsided by one sudden arrival. We have to be vigilant for these new variants and track them. Genomic epidemiology, I'm sorry, I pronounced it wrong, remains an important activity for us to understand this epidemic, Ray said. But I think right now the Lambda is a variant of interest, and we'll see whether it becomes a variant of concern. The thing we need to do is to counter new strains are the same things that we already know to do to counter the coronavirus. And the stakes are high because Delta is so transmissible. That means vaccination is more important than ever, Ray said. As the variant becomes more infectious, then proportions of vaccine people required to control the epidemic increases. And ladies and gentlemen, that is the end of the NPR article. Y'all, ladies and gentlemen, what you're seeing right now is a continuation of variants by COVID-19. Now, we mainly of concern of what's going on with the Delta variant, but now we got a new variant called the Lambda variant. And some experts say that we don't have to worry, we don't have to age as a concern, but why not? This is just as dangerous as the Delta variant. And people should need to be worried. And I know a lot of people are gonna try to like calm people down and everything else. But ladies and gentlemen, we just started to be normal again. We just started to go out again without the mask. My question is, will the U.S. government decide to put mask mandate back because of these two variants that's coming out now? And they should. Because again, I mean, a lot of people are going to say, well, some of the people that took the vaccines, you know, they're safe with the Delta variant. That's totally not true because some of the people have already died, even though they already took the vaccines protecting the virus, but still a lot of people that die with the Delta variant. With this Lambda variant, it's just as dangerous as the Delta variant. So y'all let me know what you think about this. I mean, either way you look at it, we have to bring back the mask mandate. We got to bring back basically what we used to do when COVID first hit. Wear our masks, doing social distancing, and to protect each other, because at the end of the day, you have a lot of people already dying with the Delta variant. And I guarantee this is just as concerned with this Lambda variant. So either way you look at it, protect yourself, y'all. Keep you safe and make sure you always have something to boost your immune system, because this disease ain't no joke. And also, wash your hands. Also, put hand sanitizers. As always, protect yourself. Y'all let me know what you think about this. Like, click, subscribe, and remember to click the notification bell for all the news and commentary. With that being said, this is Lions Den signing off. Deuces.